So welcome everybody to the Health Department or the Baltimore County Department of Health's webinar series. We're going to hear today from our WIC program, and I'm happy to welcome Deborah D'Souza, who is our director of the Baltimore County WIC program. She's going to go through some slides that cover eligibility and benefits, common questions, and a basic overview of WIC. So Deborah, I'll hand it to you and go ahead and get started.
Thank you, Dr. O'Dowd. Hello, everyone. Welcome. I'm going to spend the next few minutes talking about the Women, Infants, and Children Supplemental Nutrition Program. Next slide, please. So basically, I'll be telling you about what is supplemental nutrition all about, who is eligible to participate, what are some of the benefits we provide, and how we can better help you. Next slide, please. So what is the Women, Infants, and Children Supplemental Program, and who is it for? Next slide. Thank you. The Special Supplemental Nutrition Program is basically for women. Those are pregnant women, postpartum women, breastfeeding women, infants, and of course, children up to age 5. Next slide. In Maryland, WIC, besides providing supplemental nutrition, foods, also provides health and nutrition education, breastfeeding support, and referrals to other services. Next slide. So where are we located? In Baltimore County, we have 7 different sites, and most of them are in health centers. So Southwest Baltimore County, we have the Lansdowne Health Center. Then we have in the Security Square Mall complex, the Woodlawn Health Center. We have a standalone clinic in the Reisterstown area, right in the Reisterstown Business Center. It's one of our newest. Then on the east side, we provide services at the Towson Health Center, which is located in the same building as the Loch Raven Library. We also have a site down the street at the Eastern Family Resource Center. It's down the street from MedStar Franklin Square Hospital. So very convenient. Essex, we are in the Middleborough Shopping Center that houses both the health center, the Young Parents Support Center, and WIC. And lastly, at the Dundalk Health Center. So you have the health, and you also have animal services, and we're right there in that building. Next slide, please. What is the eligibility criteria to participate and receive WIC benefits? Basically 4 types. You must reside in the county, categories, and we'll talk more about what are the different categories. Income, you have to be income eligible, and then meet certain nutrition, be at certain nutrition risk. Next slide. So first, you must be a Maryland resident. And I say that because you can live in Baltimore County, but choose to receive services in, say, the city. Partly because, say, you may work in the city, or your doctors may be in the city. So you could reside in one part of Maryland and seek benefits to receive benefits in another part of the state. However, as proof of residency, we do require official documents. It could be your driver's license, which has your current address. It could be a copy of your lease or mortgage, or official mail, a copy of your BG&E bill showing your current address, or your pay stub, which may have your current address. So all these are used to determine residency. Next slide, please. Okay, categories. So you must be pregnant to participate. You must have given birth or currently breastfeeding, have an infant or a child that's under the age of 5. Next slide, please. Regarding income, I don't have the breakdown here, but if you go to the website, income is based on family income and family size. But generally, it's 185% of federal poverty level. Or if you have been approved and received benefits for SNAP or Medicaid, or you're getting temporary cash assistance, you are adjunct eligible for WIC. But you must show proof and be actively participating in these programs. Next slide, please. The next criteria for eligibility is be at nutrition risk. So the nutrition risk criteria, it has been defined by USDA, by the Food and Nutrition Services, and it's assessed by our nutritionist at the clinic. Some of the examples include complications during pregnancy. It could be gestational diabetes, preeclampsia, poor weight gain, anemia, or a general poor dietary pattern. So these are some examples that will put a pregnant woman or a postpartum woman or child at risk. Next slide. In general, half of all babies born in Maryland are eligible for WIC. So we actively reach out to our community partners, doctors, pediatrician offices, and other programs that serve the same population. Next slide, please. So what does WIC provide? What are some of its benefits? Next slide. Besides the supplemental foods, WIC also provides nutrition education, health education. We support breastfeeding with breastfeeding aids, literature, and actively do referrals to other programs based on needs identified by our participants. Next slide. The foods that WIC provides, they're generally WIC foods that are nutrients that are found to be lacking in the diet. So it is about 60% of what an individual would need, the daily requirement. WIC does not provide 100% of an individual's needs. So that's why it's referred to as a supplemental nutrition program. And the food package is tailored or individualized based on the participants, their preferences for foods, allergies, intolerances, all considered. Next slide. This slide basically shows you the examples of some of the different foods that WIC provides. You have the eggs and dairy products, plant-based milk, beverages, tofu for those that who need to be dairy-free. We also do the nut butters, legumes, dried beans, lentils, various types of canned fish, the fortified, iron-fortified, vitamin-fortified cereals, both hot and cold, Fruits and vegetables are a big part of the food package. It could be frozen, canned, fresh. Um, we also, as part of the food benefits, provide whole grain. Could be as bread, brown rice, tortillas, pastas, and our participants get to choose what whole grains they prefer. For the babies, definitely, if mom decides to breastfeed, we do support breastfeeding, but if she cannot or choose not to, then we do provide infant formulas, and as the baby grows, infant cereal and other infant foods. Next slide. Thank you. One of the benefits of the WIC program is the education component. USDA, the federal regulations require that we provide nutrition at least 2 contacts in a 12-month period. And this education could be one-to-one, individual, could be group education. It could be also through the app. So next slide. So through the app, we have various education modules. We call them one, online nutrition education. So a participant, based on the interest or, if it's a pregnant mom or a mom who's interested in breastfeeding, she can determine she wants to learn more, take some of the education sessions on the app, and it'll notify staff, and it's a credit towards the educational requirement. So, and they can access this through the app, like I said, as well as through their regular computer. Next slide. Actively promoting breastfeeding is one of the many things, many forms of education that WIC provides. All our WIC programs have a breastfeeding coordinator, and our clinics are breastfeeding friendly. And by that I mean, there's always a corner, a quiet, comfortable corner that mom can breastfeed while she's visiting the clinic. We have information that she can freely access, pamphlets, brochures, books, breastfeeding aids available, pumps. We don't advertise any formula, even though we have contracts with some of our local formula companies. We don't advertise the formula. And here in Baltimore County, we do have a breastfeeding peer counseling program. Next slide. So what is the peer counseling program? Basically, peer counselors are currently or previously have been WIC participants. They've had positive breastfeeding experiences and are now ready to be a role model for our participants. They help mom right while she's pregnant to decide if it's the best thing for her, or to do a combination, breastfeed as well as supplement with formula. They also help with how to use a breast pump, how to pump and store milk. When any problems happen or they just need support, mom can call the peer counselor. Next slide, please. All right, the referrals to other programs is a very important component of the program. We actively do referrals to local food pantries, medical assistance, immunization, housing. Most recently, we've done a lot on smoking, tobacco cessation. So we work closely with our community partners, different programs within the health department to provide referrals to other services. Next slide. Thank you. So what are the WIC authorized food list? We talked a little bit about, I shared with you the different foods that WIC provides. When a participant is in the clinic with the nutritionist, they decide what foods are best based on personal preferences, and then a shopping list is put together. The next slide is an example of a shopping list. This is the foods assigned to the mother or all the participants of the family. So it'll tell you when the benefits start, what is the period, the first day to the last day, tells you about the quantity of the food and the type of food that has been selected. So this is an example where it shows you this individual has 32 ounces of cheese, a dozen eggs, 72 ounces of cereal. And if you go down the list, you can see that even 9 containers of Similac Advanced, that's a formula, skimmed milk for the mom, frozen juice. So the list, based on preferences, are then uploaded on the WIC card. The next slide will show you what the WIC card looks like. So this is like using a debit card. It's got the client's number, but no name on the card. It's in the name of the main card holder, and the head of household can decide, pick 2 designees or proxies to act on their behalf, to go to the store, shop for the foods on their behalf. So what is the shopping experience? The next slide, please. It's basically like how you and I would shop. You go, you select the foods. This is the foods from the shopping list. The cashier rings it up. You use your WIC card to swipe. There's a PIN, like we would with a debit card. The account is then checked at that point for adequate balance of foods, and the foods are subtracted from the balance, and that's the end of the transaction. So it's very easy, very simple to use. If there is any barrier at the store, it might be actually selecting the foods, knowing which foods, which brands. But basically, once you know which foods are part of your benefits, it's easy to shop and check out. Next slide, please. So what are the benefits of being a WIC participant? Why participate and receive benefits? Next slide. WIC is one of the most studied federal nutrition assistance programs. And results show that when women during prenatal or during their pregnancy, when they participate in WIC, it results in fewer preterm births, low birth weight infants, very low birth weight infants, and also a reduction in the incidence of iron deficiency anemia. So all good reasons why when you're pregnant, you participate in WIC. This is a quote I put on this slide partly because it kind of highlights the benefits of participating. For every federal dollar invested in WIC benefits, it results in a savings of $3.50 in healthcare benefits. So from 0 to 18 years, a child and a young adult, there is a savings when we invest in good nutrition. Next slide. WIC is about 51 years old. But over the last 50 years, the program has contributed to lower infant mortality rates, improved pregnancy outcomes, overall good health in children, the use of healthcare services of all types, greater among WIC participants, and most recently, it was instrumental in the reduction of childhood obesity among low-income families. Studies done by the Center on Budget and Policy Priorities show that poverty and related disadvantages in infancy and early childhood can affect children's cognitive development and readiness to learn. Next slide. And sound investments that reduce adversity in early childhood can strengthen the foundations of physical and mental health, helping children do better in school and grow up to become healthier and more productive adults. So this was based on the study that the Center on Budget and Policy Priorities did. And the research shows that children whose mothers participated in WIC while they were pregnant actually scored higher on assessments of mental development at age 2 than similar children whose mothers didn't participate. So it's a good reason why we encourage our families who qualify to not only receive formula from 0 to 1 year, but also continue to receive other supplemental foods. Next slide. Because the benefits of WIC participation lasted into the school years. It was found that children whose mothers participated in WIC performed better on reading assessments. So what does participation look like in Baltimore County? Currently, over 16,000 active participants. A quarter are breastfeeding women, postpartum women, and of course, pregnant women. A quarter are our infants, formula fed and breastfed. And then over 50% children between the ages of 1 to 5. So this is the breakup here in Baltimore County regarding participation. Next slide. Yes. So you may have seen this poster or a billboard on buses, various sites around the state of Maryland. Basically, it's highlighting what the research out there shows. This is an example of a young adult who was a WIC baby and is now a healthy, active resident of the county. And you can read her story. There's a little website there that gives you stories of various WIC babies who are active, healthy adults living in Baltimore County. All right. So how do you get in touch with us? You can call us at our main phone number 410-887-6000 or email us at wicprogram@baltimorecountymd.gov. Might be quicker to email us. We get back to you within the workday itself, so we can assist you with the application process, or if you're currently receiving WIC benefits, have questions, we can assist you. I'll now just.
That is the last slide, right, Deborah?
Yes, so I'm open to any questions.
Perfect.
Yes, so there was a question, can WIC be used as farmer's market? Good one, yes. So WIC, a little background, Every summer we team up. We participate in local farmers markets. Um, we have pop-up markets at the clinic, and our participants can use their WIC benefits to shop at local farmers market, but they also receive during the summer a certain amount based on family size, um, where they can go to the local farmers market and purchase fruits and vegetables.
All right, so next question in the chat is how long does it usually take to get an appointment?
Oh, good question. Because we try to get you in within 3 to 5 working days. This week at the end of the month, it's a little slower, so it might be even quicker. But based on your preference, if you're a working mom, we do offer late hours in the evening. We also offer weekend hours. So we can work with your work schedule or basically your schedule. Yes.
And similar question, can someone walk into one of the WIC sites and expect to be served, or do they need to schedule an appointment ahead of time?
So we do go by appointments, but if you are at the health center receiving other benefits and you come into the WIC section of the clinic, absolutely, we can assist you with making an appointment. If you're not busy, we might be even able to, see you that very day. So it's really based on the type of day, but we will assist you. Whether it's just signing up, creating a file, or if you're a current participant, need some assistance, absolutely.
Great. All right, next question is, how do you help women that are struggling with breastfeeding?
So we have peer counselors, and we have a breastfeeding coordinator who is board certified IBCLC. Both our peer counselor as well as our breastfeeding coordinator are available after clinic hours, weekends, or through phone, or maybe even if in person, if you're having a Saturday clinic, to assist with whatever issue. Could be engorgement or any, mom has decided to go back to work, needs help with pump and store, or set up a breast pump, all of that. Our peer counselors as well as our nutritionists are trained to issue pumps, assist with breastfeeding aids.
All right, great. Next question. So once you get an appointment, how long does it usually take to get your WIC card and be able to redeem your benefits?
Yes, I should have been cleared. The day you qualify and found eligible, you get benefits. So you will leave that day with your card loaded with your benefits, shopping list, authorized food list, all the referrals that you need, all done at your first appointment.
Awesome. All right, so moving on, I'm going to combine two questions that are somewhat similar. Can WIC help with transportation to appointments? And if not, how does WIC engage with families who may have difficulty coming into the clinic?
Very good question. We wish that we could work closely with transportation to assist our families. That is something that is being explored at the state level, at the national level, because transportation is an issue. Public transportation is not always available, even though we have locations. We are at locations on public bus lines. Yes, we wish it could get better for our participants.
All right, I've got a couple other questions just on eligibility and a few other things. So, for postpartum women, how long do they remain eligible for WIC benefits into their postpartum period?
Yes, so if a mom decides not to breastfeed and her infant is receiving formula, she can stay on WIC for 6 months postpartum. So till baby turns 6 months. If mom is breastfeeding, then she will receive WIC benefits till baby turns 1. So, and if mom's doing a combination, she can stay on the program and receive benefits till age 1.
All right, great. And do I need to have a social security number in order to be eligible for WIC?
No, you don't need a social security number. We don't ask and we don't record social security numbers.
And do I need to be working in order to be eligible for WIC?
Working. No, no. If we look at family income, so it could be other members of the family that are working. You could be receiving temporary cash assistance, disability, SSI. So the answer is no. Yeah.
All right, so last call for questions. I'm taking a look at the chat. I'm going to ask Deborah one more question of my own, and anybody else have last burning questions, feel free to put them in. So Deborah, my last question is, um, how can I be sure that my health data or personal information is not shared with anybody when I come to visit WIC? Do you guys routinely share that information with any other agency or anybody else?
Good question, Dr. O'Dowd. WIC does not share any information. The only thing we share is our statistics. So participation, enrollment. However, we do have currently an MOU with the immunization program as part of our efforts to make sure our children are immunized. Those that are during their visits to the clinic when they're screened and found not to be updated, that their immunization not up to date, we do refer them to the county immunization program that follows up to ensure that the child receives the scheduled shots.
Perfect, thanks. All right, so I'm not seeing any more questions in the chat. So thanks again, Deborah, for this great overview of WIC. Thanks for answering all of our questions. And hopefully this is a helpful resource for anybody in the community wondering about WIC benefits and how to access them. Thanks, and we will see you all later at our next webinar.
Thank you, everyone.